Well, good morning. On behalf of Mayo Clinic and on behalf of the Center for Individualized Medicine, welcome to this year's Individualizing Medicine Conference. We have a tagline, from promise to practice, and it really says it all. We're here to collectively make sure we take the promise of genomics and transform that into the practice of genomics. I'm really on stage for three very brief announcements. The first is to welcome you and to thank you for coming, so I've done that. The second is to briefly introduce myself. My name is Gianrico Farrugia. I help run the Center for Individualized Medicine. And the third and the most important is to introduce onto the stage the person who's going to formally open this year's conference, Dr. John Noseworthy. Dr. Noseworthy is the president and CEO of Mayo Clinic. It was actually his vision to bring together research, education, and practice under one umbrella, and that has really enabled us to accelerate the transformation from promise to practice. And therefore, we're really glad that he has had the opportunity to come and formally open it. We thank him for doing that, and here he is, Dr. Noseworthy. Thanks, John.
Thank you, Gianrico, and welcome to all of you. I want to briefly underscore why we're all here today. As many of you know, Mayo Clinic is built on one principle. The needs of the patient come first. This is why we exist, and it is our purpose. Our physicians are salaried, our staff is dedicated to service and value. Research informs our practice, and we are educating the next generation of healthcare providers. I really don't need to explain our mission to you because you can stop any one of our staff and they will be happy to tell you. We're here to meet the needs of our patients. That said, in planning the future of Mayo Clinic, we decided that in order to maintain the highest level of patient care and the ability to translate discoveries into practice faster than other institutions, medical genomics needed to be a major pillar of the institution. Accordingly, we made a substantial investment. Why do we do this? Simply, Mayo has always been an interdisciplinary medical practice, and like the Mayo brothers, we've always used the latest evidence-based methods to care for our patients. Medical genomics at Mayo is not only an avenue of research, it's an integral part of medicine. It has permeated virtually every specialty at Mayo over the past 2 years. A year ago, we launched the Individualized Medicine Clinic, which employs medical genomics to help hard-to-treat cancer patients and those with undiagnosed conditions. We've developed hundreds of genomics-based tests and made them available to the world. The Center for Individualized Medicine at Mayo belongs as much to our medical practice as it does to our research effort. In fact, we have effectively removed the boundary between practice and research. And as many of you know, the center also conducts educational programs. It's the future of medicine, but it's also a reality. We use medical genomics every day to treat our patients. We tailor medications to match the needs and the genomic makeup of the patient, giving the right dose of the right drug to the right patient. We translate genomics into the practice through clinomics. We seek new biomarkers of disease to create drugs, prevent illness, and predict outcomes. We use epigenomics to understand the environmental impact on gene expression, and we are studying the microbiome to heal and protect patients by managing the microbes we host. We know a lot still needs to be done, and this recurring conference is part of that ongoing effort and our commitment. Thank you for coming. Thank you for helping us highlight the science and explore the issues, including how to translate medical genomics with methods of high integrity, safety, speed, and value. Mayo Clinic is absolutely committed to individualized medicine. It is in the best interest of our patients.